Now, lifestyle-related diseases remain a major public health concern in South Africa. The Health Department says diseases such as diabetes, hypertension and cancer have surpassed the COVID-19 pandemic as the leading cause of death in the country. The department has urged citizens to exercise regularly and avoid excessive consumption of alcohol and tobacco. South African Medical Research Council Chief Specialist Professor Goedecke joins us to discuss the dangers and consequences of obesity. Professor Goedecke, thank you so much for joining us and a very good evening to you. Very shocking finding that illnesses like diabetes and hypertension have surpassed our COVID-19 pandemic numbers. How did we get here?
Hi, Martha. Thanks for having me on the show. I think the obesity prevalence has been increasing at an alarming rate over the last 50 years. Especially we've got data over the last 20 years, and it's increased by about 34%, and women being more affected than men. So that all these diseases are intricately related to obesity. So then obviously this has a knock-on effect.
And why so that women being more affected by men?
I think that's a very good question. There's a lot of factors involved. I think there's a lot of psychosocial factors, cultural factors involved, and also lifestyle, where women's sedentary behavior is very high, not taking part in much physical activity, also increase in calorie-dense foods, but just the environment around us is really forcing this obesity epidemic.
And Prof, what are the dangers of living with obesity?
Well, as you mentioned, it increases the risk of heart disease, diabetes, certain types of cancers. And if you actually look at the deaths related to diabetes, endometrial cancer, hypertensive heart disease, about 2/3 of this can be attributed to obesity. And obviously it also increases the risk of things like osteoarthritis. So mobility is a problem, and that exacerbates the obesity problem because people can't move effectively. And also it has effects on mental health. I think the quality of life of individuals is compromised when living with obesity. And it's been shown that people living with obesity have twice the number of mental health disorders as those without obesity. And then obviously this then is exacerbated by the stigmas associated with obesity. I think there's a lot of bias and discrimination, and this is then exacerbates the problem.
And how do we then dispel or get rid of this bias and the stigma when it comes to obesity?
I think people have always seen obesity as a disease of gluttony and eating too much, not moving enough. But recently, obesity has been regarded as a medical disease. And now it's actually getting the attention it should, where there are actually medications that you can take, similar to as if you're living with diabetes, you would take medications every day. The same thing would happen with obesity, so it's seen as a medical condition.
And according to a study that was conducted by Stats SA back in 2020, it was about 31% of men who were living with obesity, women at 68%, as you mentioned, it being more affected by women than men, and children at 13.5%. who were reported to be overweight or obese. It's 5 years later. Are these numbers showing even the slightest bit of a dent, or are they kind of plateauing or increasing?
No, unfortunately, they are increasing. I found a study that was published by the SA National Food and Nutrition Survey, and this was done in 2021, and they've shown that the prevalence has increased further. So what you're describing is the prevalence of overweight and obesity, and just obesity alone was 34% in 2021.
Sure.
And also when you look at children, So those are stats for children aged 0 to 5. And as children increase, the prevalence of obesity increases exponentially. So teenage girls, the prevalence of overweight and obesity are as high as 27%. And as they move into adulthood, this actually creates even more of a problem.
And what would you say the do's and don'ts are? You know, we've been told time and time again to eat right, to exercise, you know, minimize or not take any alcohol or tobacco. But a lot of the times, Prof, when it comes to eating right, a lot of the sentiment that comes through is just the way in which you can do it that is cost effective. As we know, many South Africans are tightening their belts, and the concern is that it appears that healthier food may be a bit costly sometimes. Is that a misconception?
No, I think you spot on there. I think, you know, if you want high quality proteins and that's, you know, animal-based protein, that is high in cost. A lot of vegetables are high in cost. But I think you can make healthy decisions. And I know the Department of Health are working on obesity strategy and just focusing on plant-based proteins such as lentils, chickpeas, any type of beans to get high quality protein, which are low in fat, and reducing all the sugar in foods, no sugar sweetened beverages. And, you know, the government has instituted the health levy, which actually has been effective at reducing the intake of those, especially in the lower income settings. But I think this has to be done at a higher level. And I think people don't have access to food. And as you say, well, why is there such high obesity where there's so much food insecurity? And it's because people are choosing low quality foods. So as you say, rather redirect those taxes from sugar sweetened beverages to subsidizing low fruits and vegetables and healthy types of foods.
How would you advise a parent sitting at home watching this, thinking perhaps their teenage child may be obese? How would they tackle that kind of, firstly, that conversation with a teenager, and also moving forward, practical steps to try and help them?
Yeah, I think, you know, it's not up to the individual alone. You know, it's a whole community. It's fight we have to fight. And so I think from the parents changing their behaviors and modeling good behaviors, and also changing the environment and speaking to the school, changing what's available in the tuck shop and around the tuck shop, that's also bad. And even, you know, from a governmental level, changing the marketing about you know, unhealthy foods, avoiding takeaway foods, and really focusing on fruits and veg and healthy types of food that then the child will grow into the weight rather than focusing on stigmatizing obesity.
Prof, thank you so much for your insights. Really, really appreciate it. Hopefully, we will try and take some in as well. That's Professor Goedecke, who is the Chief Specialist at the South African Medical Research Council.